Hi, this is Ian Wright, the osteopath, and I would like to just do a little bit of a talk on osteopathy and glue ear, or chronic serous otitis media. I specialise in treating, I spend a lot of my time, let's say, treating children, young children, babies, teaching paediatrics internationally, and we have a special clinic in my practice where we teach postgraduate osteopaths and a diploma in paediatrics and run a special needs clinic as well. So I've been teaching probably about this subject, amongst others, for about 25 years, I would say. So just wanted to kind of let people have a little idea of what the thinking is behind us when we try and approaching this kind of particular problem. But anyway, let's talk about it first of all. Glue ear is different to a normal ear infection. Both have fluid in the middle ear. We're talking middle ear, not the outer or the inner ear. The inner ear is more about balance and some of the deeper levels of hearing. The middle ear contains the fluids, the eustachian tube, which drains the fluids into the back of the throat through the ear. Now, an ear infection, you get fluids building up in the middle ear, but it's infected. So you tend to get fever, temperature. When you're looking at it with an otoscope that looks into the eardrum is red and it's often bulging. Okay? In glue ear, which is slightly more of a long-term thing, there can be no pain. There can be hearing loss, there can be a fullness in the ear, the child can pull at the ear, sometimes their behaviour can change a little bit, but there tends to be no infection. Now, this is different also to CSOM, which is chronic suppurative otitis media, which is, again, it's an ear infection where the tympanic membrane or the eardrum is burst, and this comes from an ear infection, and that needs different kind of approach. For here, we're talking about more of a glue ear, which is, in a way, it's a blocked ear, and it tends to affect hearing. Now, the interesting thing is most babies or children's ears can be blocked up. Actually, 6 in 10 newborns fail their first hearing test due to fluid being in their ears. So it usually goes in about a month or two. But the most kind of common time for getting a kind of glue ear situation is sort of 6 to 12 months old. But most children actually go through a period preschool where they have a kind of glue ear type situation. But it's not the end of the world, and if it drains and clears, which it usually does within sort of 2-3 weeks, it's no problem, and it's a natural thing, and it can sort itself out for itself. The problem is when it goes on for sort of more than 3 months, and or if it's severe, because it's very importantly affects the development of speech and language, which is wiring up, the brain is wiring up at that particular time. So actually speech and language, being able to hear what you say and hear what other people are saying, is very, very important. So that's why it's good to hear anyway, but the language is a really key part of why it needs to be kind of addressed. Often, if it's been left and it's severe and it goes over 3 months, they tend to look at grommets, which kind of drain through the ear. It's surgical, has general anaesthetic, and they can scar the eardrums, and they don't necessarily cure the glue ear, but they can help it in the short term. I suppose what we're interested in is looking at other ways to try and help this situation. There are certain conditions which can predispose one and to glue ear or chronic serous otitis media. By the way, it's called serous because it's the fluid. It's like a yellow straw-like fluid that builds up in the middle ear, and you can kind of see that as well. ASD, autistic spectrum disorders, have an increased tendency to glue it, and it's very important, actually, when you're looking at autistic spectrum, especially with regards to speech and language development issues, that the ears are checked, because actually if you can't hear, language doesn't develop, and so there can be a confusion in the diagnosis with autistic spectrum disorder. So it's something to always to kind of differentially diagnose, as with other developmental disorders, general global developmental disorders where speech and language are slow to develop. They has to be differentially diagnosed, but also it can predispose as well. Also, Down syndrome's it's very common to have ear problems as one of a series of different areas of difficulty in Down, because the eustachian tubes tend to be short, and the facial dynamics tend to be quite squashed in that particular area, including around the inner ear. So, and also actually because around the throat. So there's a lack of kind of drainage, which can affect quite strongly, and is quite common in Down syndrome. Also, the sinuses in Down syndrome tend to be quite blocked up. So one of the most common causes can be enlarged adenoids. The bottom of the adenoids can actually block the bottom of the eustachian tube and stop the drainage. So that's another area that has to be kind of checked. It's normally diagnosed by tympanometry, which is kind of checking out the sound response in the ear, or pneumatic otoscopy, which is actually putting a pressure in to actually see if the eardrum is under pressure. So that's diagnosed normally by an ENT specialist. But really what I'm interested in is not this side of it, it's actually what we can look at and what we can do with it osteopathically. So actually, first of all, we want to look at predisposition. What's actually causing this issue? Now, for me, there are two areas here of difficulties. Number one is the production of the kind of mucousy fluid. Is there too much production? And that can happen in allergies, sinus type pictures. For example, if there is a lactose or a dairy allergy, there can be an increase in mucus production in the middle ear. And problems and allergies in the gut can actually resonate in the ear. The mucous membranes resonate in both areas. That's an interesting area of research. So an increased production of the fluid is the first part. The second part is a problem with the drainage. The drainage is a key part. Now, the eustachian tube in a baby and a child is short, and it lies horizontally. As the baby, so because what happens is the middle face, the maxilla especially, and the mandible, the lower face of a baby is very small if you look at it. And what happens as they grow 5, 6, 7 years old is that middle face tends to lengthen out, especially through the maxillary bones. And as that lengthens and the face lengthens out, the eustachian tubes, for number one, they grow in length, and number two, they drop to an angle of around 45 degrees. So what you have is a little bit more of a gravity drainage situation happening, where in babies they just don't have that. Now, couple to that the whole teething issue. What happens is when you're teething, it can lock up the jaw joint. Now, the jaw joint actually hangs from the temporal bone. The temporal bone is the bone that the ear sits in. And so if all the jaw is locked, it can lock that bone up and stop it, that little tiny bit of give that it has, which allows drainage. So the whole thing backs up. And that's a very important, another predisposition. So often children get ear infections or blocked ears when they're teething. It's very, very common. I see it every day. Coupled with this, there are difficulties with what happens is the eustachian tube drains down into the back of the throat. Now, if the throat is blocked, or the tonsils are up, or the adenoids, as I've said, are up, and there's lack of drainage through the throat, especially in postnasal drip sinus type patterns, there's a lack of drainage, so everything backs up from the throat into the ear, and you don't get this drainage type situation. So the function of the palate's very important, and the function actually of the tongue as well, but I'll come to that in a minute. So what is interesting from what we do, which is osteopathy, and it's particularly cranial osteopathy. The doctor called Dr. William Sutherland, who was an osteopath in the 1870s to the sort of 1930s, and he discovered actually that these kind of movements that he was looking at in the cranial bones from looking at these particular ear bones, the temporal bones, he looked at a skull that had been taken, each bone had been taken apart, it was disarticulated, and it was in this study of Dr. Still, who was the founder of osteopathy, and he would look at this temporal bone, which is the ear bone, and it looked to him like gills of a fish, and he said it must have function, it must be able to move. And so he spent the next 30, 40 years researching this, and that started the whole cranial osteopathy thing. So temporal bones have this tiny fluid movement, and it's like a pumping movement. And this movement actually is, you can teach anyone to feel it. It's not actually very hard to feel. It's no great skill for anyone to feel it. It's very hard to research, actually. They were researching this work at MIT in Boston, and they taught the researchers how to feel these cranial bone movements. So they're very, very micro, very tiny movements. And it took them 10 minutes, actually, my colleagues, to actually teach the researchers to feel the movement. But the researchers said, this movement is so refined and so small, and that it will take us 100 years to find a method of actually measuring this movement, because you have to rule out breathing, and you have to rule out pulses, etc., etc. And it's tiny micro movement that happens. But actually there is some research, certainly out of Russia, where they take multiple functional MRIs, where they see these tiny changes, shape changes in the skull. Anyway, let's take it for what it feels like, which is these temporal bones are supposed to move. And this is very important in a baby and a child. Certainly a teething child, the temporal bones get locked up. They get an ear infection. Or the lack of drainage. So what you've got is a eustachian tube that's horizontal and is short, and you've got a temporal bone, which the actual eustachian tube sits in, that is not moving. Hasn't got this gentle fluid movement which pumps it. You're going to have a stagnancy and a build-up of fluid, i.e. glue in. So what causes these bones to lock up? As I've said, teething, but actually there are certain things pre-birth and birth that can make these cranial bones have this lack of movement. The most obvious is squashed heads. Babies' heads get squashed more often actually pre-birth than in birth. If they're lying very low, head down for a long period of time, the top bones, the vault bones, get locked down onto these cranial base bones like the temporal bone and stop the movement. So this is the kind of squashed, molded type baby's head. Now sometimes these squashed, lack of movement bones, you can't see that, but actually we can feel it. You can feel it through lack of movement. That's why it's very good to get all babies checked by an osteopath, just to make sure everything's free and moving. Breech babies, everything, because of the forces are upwards through the temporal bone area around the ears, everything locks them backwards a little bit, and it can make those children much more prone to, even if the baby's been breeched for, in utero and there's no breech delivery, it's just they maybe have been breeched for 10, 15 weeks of the pregnancy, can really lock up those temporal bones. So you've got pre-birth situations, you've got birth, if they have forceps, or they have the Hoover, the Von Toos delivery, it puts a lot of drag on the skull bones and the membranes of the head and can lock up these areas. If the cord is around the neck, that tends to lock up the drainage of the throat. So you've got all these kind of areas of the body that can be locked up. What we're really interested, very simply, as osteopaths, is getting movement and function, freeing up blocks, as simply as that, and getting everything moving, draining, and functioning, be it the throat, be it the ears, drainage, the eustachian tube, or the sinuses, which can back up. Our job is to kind of free it all up. Obviously, there are the allergic situations. Smoking has been very clearly shown to increase chronic serous otitis media. The production, an allergic reaction to certain substances like cigarette smoke or dairy produce can increase the mucus production, especially in the inner ear, and gut problems. So it's always important to look at the gut bacterial function, and for example, cesarean section babies, their gut biome or their gut inherent bacteria are just not quite as switched on. So probiotics are very important, I think, with all children with glue ears. I think that's very important because it can help with mucus production to some degree. But what we tend to do now, some glue ear can be very serious. I mean, like for example, in some Down syndrome children, the eustachian tube is just too small. It can be just developmentally too small, and you can free up the bones as much as you like, and it can't necessarily fix it. But we treat a lot of children with Down syndrome with ear problems, and sometimes it can be helpful. In other children, what we tend to do is, what I tend to do personally in my practice and what I tend to teach is, we'll have a go. We'll try 3 sessions and see if there's a change in hearing, because actually the issue tends to be hearing. The child can't hear you, and that's the most obvious cause, because often a child with chronic serous otitis media, there's no pain, there's no increased temperature, they just can't hear. And so what we do is try 2 or 3 sessions, see if we can get a change in hearing, or get it retested is the best way, and see if there's a movement in it. Obviously, the last result is to have surgery, but I always think it's worth having a go, seeing if we can get everything draining a little bit as a first kind of point of call, because it's the least invasive, and it can help. It doesn't always help, certainly, but it helps in enough cases to make it worth a try. Anyway, that's a kind of bit of an introduction. It's a wide area, and I'm going to come back and talk more about balance, vertigo, Meniere's, and all sorts of issues around balance and everything like that next time. I wish you well.